of the shoulder and sports surgeons at Orthopedic Specialists of Seattle. Today we're going to show video testimony of a more interesting surgery and patient case. So this patient came to me from pretty far away, and their rotator cuff had been torn in 3 spots and fully retracted. And unfortunately, given some of the parameters on the MRI and the time it's been injured for, it was not fixable. And so in this case, depending on the patient's age, activity level, etc., the options are kind of limited. So we have a newer thing called a lower trapezius transfer. We take part of the trapezius muscle, we can transfer that with a tendon attached to the rotator cuff or the humerus, and it can give back some strength, especially this one where you're reaching out and you don't drop the elbow, or external rotation strength. What we've also seen is it actually can bring up some strength this way too. So he went with it. It went really well. It was very smooth, and you can see the results of it after this.
I injured myself back in July of last year, and I have rotator cuff damage in the past, so I just thought this is one of these things I was going to have to work through. After about 8 months, my wife told me it's time to have a doctor take a look at it, and when I came in here, you guys did the MRI and found out that 3 of my tendons were completely torn off in the front shoulder. Dealt with a lot of pain for 9 months, and after seeing you guys and you did the surgery, it's just been fantastic. But I was very limited on what I could do with my right hand prior to surgery. One was to get a cup out of the cupboard every morning for my morning coffee, because habit has always been my right hand, and I really had to start using my left hand. And the times I'd forget because I was groggy, I'd lift up my right hand and just it would not move. So after you explained to me what was going to take place, of course I've never dreamt I'd ever have to have cadaver parts in my body, but the way you explained everything to me, it was crystal clear to me what needed to be done. And I thought, well, you've been doing this, you know what you're doing. So in my mind, I was telling myself, you're the best that can be doing this. And so it just made me more comfortable knowing, but I can say it was extremely thorough, your explanation of what was going to take place. I kept thinking at some point this is really going to start bothering me, but no pain at all during the whole recovery process.
In terms of your strength, how did you notice in terms of the last few months, did you notice improvements in that?
Yes, just at the beginning of physical therapy, it was just moving my arm and doing a lot of arm rotations and movements. And when I started actually doing weights, it was 1 pound and 2 pounds. And I kept thinking to myself, at what point can I jump up to 5 pounds? But the physical therapist was very clear to me that we're following the doctor's orders. We're going to do exactly as he says. And it was a progression that I could see the results. And to put it in the right perspective, it was never, when I would bump up a half a pound or a pound, it was never painful during that whole process. It was, well, to tell you honestly, I thought it was going to be a little bit longer process for me to recuperate. It has been wonderful. My expectations were give it 6 months, see where I'm at. When the therapist told me last week, which was just about 5 months, he said there's no point in coming back in. I'm doing very well. The movement, my strength, everything is coming back in very quickly. And the only advice he gave me, and he really made sure I listened to him carefully, is don't push yourself even right now. Just keep doing what you're doing, slow increments. But, getting up in the morning, reaching for that cup out of the cupboard with no pain at all, playing. I've got 11 grandchildren. I'm able to get down on the floor and play with them now. And even though I'm a little bit guarded of my right shoulder because they do like to jump and go crazy at times, it's just been a wonderful experience on how quickly my body's responded to this.
Are you happy you did this?
Oh, I will tell anybody that wants to listen to me the full story about this, because I could probably go on for about an hour explaining what a wonderful experience this has been.
If a friend needed the same surgery, would you recommend it?
I'd tell him he's crazy if he didn't.